Hello, my name is Kate Hanneman. I'm a cardiothoracic radiologist from the University of Toronto and the author of a recent special report published in Radiology related to climate change as it impacts medical imaging and radiology. I think it's really important to start thinking about and talking about climate change as it pertains to medical imaging and radiology, given the immediate and near-term health impacts related to climate change and health equity concerns. So we know that climate change will result in changing weather patterns and other disturbances that will have direct impacts on human health, including extreme weather events, which we're already witnessing. Those can, of course, lead to mass casualties and large numbers of death. But there are also important indirect effects, including impact on the nutritional quality of food crops and changing vector-borne illness patterns. And radiologists really are ideally suited to lead some of the initiatives that we need within the healthcare system more broadly. We're adept at managing rapid change, typically, or in the past as it's related to technological development, but we also have relationships across our healthcare systems with multiple specialists and different departments. And so are ideally suited perhaps to lead some of the changes and communication that we need in our healthcare systems. As radiologists, we're also going to see some of the health impacts of climate change, both in our imaging and changing disease patterns. And we need to be prepared for potential mass casualty events related to extreme weather events that might also directly impact our departments and our healthcare systems, for example, by impacting our IT systems or even our PACS systems. And so we need to start thinking about both mitigation strategies for decreasing our emissions, but also adaptation strategies to be prepared for these type of events. There are many steps we can take as radiologists in both our personal and professional lives to start addressing climate change and decreasing our emissions or addressing our carbon footprint. We've outlined some of these in our article and have tried to link each specific action with the anticipated outcome or impact with quantifiable data when that was available. So some of the steps people could start thinking about making in their personal lives relate to alternative transportation options for going to work, for example. If you have the ability to cycle to work, not only will that decrease your emissions, but of course may have cardiorespiratory benefits and other health benefits. We can also think about the things we eat. This has a substantial impact on greenhouse gas emissions, of course, much higher emissions related to meat and dairy industries. And so by increasing the amount of plants we eat as a more positive way to think about things, we can have a fairly substantial impact on decreasing our personal greenhouse gas emissions. And I think it's important to remind people that this doesn't have to be all or none. You don't have to think about the large potential change to switching to a completely plant-based diet, but you can make small changes, even one meal or one day a week, and potentially build from there. In our departments, we can make changes to decrease waste, whether this is from switching from single-use contrast vials to multi-use systems, working with our suppliers and vendors to decrease packaging, and also doing simple things that we can apply both in our homes and in our departments, like turning the lights off when rooms aren't in use on evenings and weekends and turning off electronics. Some of the largest energy expenditures in our departments related to medical imaging specifically relate to the large energy expenditure of CT and MR scanners. And there's been a recent paper published in Radiology that actually showed that a large amount of this energy expenditure is during non-productive times. So for example, in evenings and weekends during idle states when patients aren't actually in the room with active image generation. And so if we have the opportunity to turn scanners off when they're not in use, for example, in an outpatient department, or to work with vendors to improve the idle state of our scanners, so decreasing the energy consumption when the scanners aren't being actively used for image acquisition, we can have a substantial impact on our energy expenditures in our departments. There have also been some fantastic research that looked at our energy and carbon footprint in interventional suites, and some recent research showed that climate control systems are actually the largest contributor in interventional radiology. And so again, important to have kind of a tailored approach when you're thinking about changes you can implement in your department. So perhaps in interventional suites, you might want to install occupancy sensors so that rooms can, shift to a larger range of temperatures when they're not in use, for example. And some changes, that are fairly readily able to be implemented include switching from fluorescent lighting, if you still have that in your homes, to LED technology, fairly low cost, and can really decrease your energy expenditure if you implement it broadly. And of course, if we all make these small changes, they can have fairly large impacts. I do hope that radiologists more broadly will start leading these conversations in their departments, and we can start decreasing the energy expenditure in our departments and health systems more broadly.